Matt.
Thank you. Thanks for a big crowd today. When I look across this panel, I realize two things. One is that you probably didn't come to hear about from me. And second is I better talk while I've got the chance because I probably won't get to speak again. Just on the supply side of healthcare services. First is that clearly there's an opportunity to improve efficiency within our system. Evidence of this would be for any of you who have tried to help a loved one through the healthcare system. The handoffs between organizations in particular are at best cumbersome, at worst dangerous. We do have an opportunity to make improvements here. One of the programs that we've implemented in Toronto is looking at doing an e-referral system for people who are receiving hip and knee treatment. What's amazing about this system is that we would book your destination at the time of pre-admission. So this worked wonderfully well from an efficiency perspective. We can show that resources are being utilized more effectively. But more importantly is this actually improved satisfaction for our
Mr. Brown.
patients.
Great, thanks. So chronic disease is a crisis, and along with the other big three of sustainability, patient safety, and the equity of our system, there's probably no greater challenges facing us today. But when you look at the journey from a patient perspective, you look at the tasks and the challenges that face any family or general care provider working with chronic disease patients, it becomes clear it's a pretty complicated challenge. The only way that we're going to get over this challenge is by really making sure that everything we do, like any public health challenge, follows some consistent principles. Let me talk a little bit about the scope of the challenge. We can talk about the numbers, the really hard numbers of almost $30 billion. We can talk about the hard numbers of almost 60% of deaths being linked to chronic disease. We can take it down to the people we see every day when you think that it's 8 out of 10, 4 out of 5 Ontarians over the age of 45 have a chronic disease. And of those people, 7 out of 10, and that's still over 2 million people in this province, 7 out of 10 have at least 2 chronic diseases. So it's an incredibly dramatic and personal impact on almost anyone that we know. Sooner or later, they'll be coping with a chronic disease. The first is the about $500 million or more investments over the next 4 years that we'll make in improving chronic disease. Matt's right, e-health is a key enabler, but it doesn't solve it. We're getting an electronic health record that makes sure that the providers actually have access to drug and lab and other key data, making sure that that's turned around so that patients and people can actually start to manage their own health care.
Please welcome Dr. Chan.
Thanks very much. It's a pleasure to be here. Pleasure to be part of this debate on chronic disease management. This is all about patients and the people that we serve. And we all know, all of us who work in chronic disease management, that we're not doing enough for our patients, that somehow, somewhere along the way, that we're failing them. That we all know that when it comes to many measures of good chronic disease management, that less than half of patients are hitting their targets. Less than half of patients in Ontario are hitting their targets for hemoglobin A1C. Other studies are showing similar problems with the way that we manage lipid controls. Louise Pilat, who's looked at drug management, has shown that when it comes to use of the evidence-based medications, whether it's things like beta blockers or ACE inhibitors or statins for coronary artery disease, we typically only prescribe them on about 2/3 of the patients or less when the benchmark should be up around 85.